Namaste. A very good morning, good afternoon, and good evening to all of you. Welcome to the fourth session of She and Rights. This session of Sexual Health with Equity and Rights Media Initiative is co-hosted by National Coalition of People Living with HIV in India, that is NCPI+, Global Center for Health Diplomacy and Inclusion, that is CeHDI, International Planned Parenthood Federation, IPPF, Asian Pacific Resource and Research Center for Women, ARROW, Women's Global Network for Reproductive Rights, WGNRR, and CNS. The theme for today's session is Sexual and Reproductive Health with Equity and Rights for the Young People. Today we will listen to a galaxy of youth speakers from Asian and African region who are making a difference in sexual and reproductive health and rights in a phenomenal manner. This is what gives me hope despite the growing anti-rights push to gender equality. Whether it is countering the anti-rights agenda on the ground, at the local and regional level, or the regressive Geneva Consensus Declaration at the global level, we all stand united for gender equality and human rights. So do we believe. Unless we can ensure gender justice, we cannot deliver on social, economic, climate. Participants can please type in their questions and comments in the chat box even as the speakers present. You do not have to wait till the end of the session to do so. Please also mention the name of your media outlet. We will take up as many relevant questions as time permits after all the speakers have presented. Also, please keep yourself muted as the speakers present. Thank you for your attention. I now invite and welcome our first speaker for today. Welcome Lady Nancy Lisondra, Youth and Advocacy Advisor at IPPF for the East and Southeast Asia and Oceania region. Alongside being a registered nurse, Lady is a youth leader and activist. She has worked on issues of young people, HIV, gender, and sexual and reproductive health and rights for over a decade. She has a broad experience in working with different groups of young people and youth networks in both development and emergency settings. The floor is yours, lady.
Hello and welcome to everyone. I hope you're able to hear me clearly. Thank you all for joining. And shout out to all the young people and the young at heart in the audience. So here, allow me to share my presentation. So being the first speaker is a little bit tough. I will try to set the tone in terms of where we are right now and why is it important to talk about sexual health, equity, and rights specifically for young people. So here, let me introduce to you IPPF first. So IPPF, or the International Planned Parenthood Federation, is a locally owned, globally connected civil society movement delivering healthcare in over 140 countries. For more than 70 years now, IPPF has worked to advance sexual and reproductive health and rights so that people everywhere can live healthier, safer, and more fulfilled lives, free from discrimination and coercion. So we actually come together, despite all these differences in opinions and things, to promote sexual and reproductive health and rights, and to provide care, and promote human rights. We believe that sexual rights, reproductive rights are human rights, and we stand in solidarity for change to move the sexuality agenda. So I just want to give a brief background. Like we mentioned about, Shobha's mentioned about these processes that are happening this year. So one key process that is happening is the 69th session, the Commission on the Status of Women, taking place in New York this coming March. So the session will focus on the review of the implementation of the Beijing Platform of Action. This is a very important document. We say it's a milestone document, as this laid out like what development priorities are there for women and girls. So this review includes assessment of current challenges affecting the achievement of gender equality and the empowerment of women, and its full contribution towards the realization of the 2030 Agenda for Sustainable Development. So linking that, the Beijing ICPD review with the SDGs. So ahead of these, there are a lot of fora that took place to take stock of our progress. Even so, we've like looked at the region, and we did see like a drop in maternal mortality, and it has also seemed to decrease globally. However, the progress has not been sustained in the era of the SDGs. It's been uneven in our region with the continued loss in lives of mothers that are really preventable. So pregnancy and childbirth. And we see the rates in Asia translating to 400 women dying every day. And this is still unacceptable. While we see progress, this has also been stagnating. If we look at the review by SCAP on 2024, they've also shown this the indicators that we are progressing and the indicators that have not. So we go into the SDG indicators, so the Sustainable Development Goals, very lofty goals set in 2015. But the sad news is that we will not reach the SDGs in 32 years. We're 32 years behind schedule, and 89% of the 116 measurable targets will miss by 2030. So this is why this is the agenda that's left behind and that we're pushing and we're drawing the attention towards. What have we done well in our region? It has been SDG 1 checked, and SDG number 9, innovation. So no poverty, and industry, innovation, and infrastructure made the greatest progress. But then we have also the DARS in data, already 15 years, we're midway or almost finishing, like reaching 2030, but we still have no data for SDG 5 and SDG 16, which is gender equality, peace, justice, and strong institutions, which is very relevant in our region. With all this political instability and, as Shobha has mentioned, like the growing anti-rights, but these are also effects of geopolitical powers that has subjective sexual and reproductive rights as a tool. Also, sadly, SDG 13, climate action has regressed in the region where we are most vulnerable, Asia and the Pacific, in the area of small island states. We have regressed in climate action. And disaggregated statistics are available only in 5 dimensions for 29 out of the 231 indicators. So as you can see, we need a more honest to goodness like lens, a gender lens at looking at this and a better way to measure this. Because what we see is that we are not seeing progress because of inequality, discrimination, bias, and stigma. So these continue to pose threats to our health and well-being. So it's sometimes far off, right? The issue of sex, sexuality, sexual health. What does this have to do with development? But in truth, everything is very much connected. Because what we see in the reports are that you can actually attribute sex to being a disadvantaged group. You would see women and girls face challenge in education and employment, so accessing school, going to school, getting a job. And some of these are very simple, such as access to decent like facilities for menstrual hygiene products and these things. A lot of girls still can't go to school because they are not even able to menstruate with dignity. And on the flip side, boys and men face challenges related to health and personal safety. you could see like indicators on SDG number 3 were falling behind because there's high death rates, suicide, accidents, and those vulnerable are men and boys. Okay. So moving past this, we tried to look into some structural, like why are these structural barriers, like understand these. So we worked with the European Parliament Forum for Sexual and Reproductive Health and Rights, EPF, to look in policies in the region to investigate how authorities perform in access to contraceptive supplies, family planning, counseling, and online information on contraception. So we had the Contraceptive Policy Atlas 2023, and it shows that 74% of the countries in Asia and the Pacific have laws and regulations that guarantee access to sexual and reproductive health care, information, and education. But because of a lot of geopolitical shifts, these laws have been changing. Some in the region have progressed, some have regressed. Like in, say, for example, the laws on gender equality, same-sex marriage, they have progressed. But for example, in the Philippines, where abortion is still restricted, so this still is not moving forward. So there remain significant challenges in accessing sexual and reproductive health services, such as limited coverage in national health insurance, high pocket expenditure, and even parental consent. To vulnerable women and girls, especially girls who are not even earning a living, it means a lot where they can, the price of rice is actually the same price as your menstrual product, and then it puts you to a dilemma. So you need to sometimes choose and sometimes deprioritize your sexual health needs or reproductive health needs. In many countries, there's limited publicly available data. While this is quite general in terms of the SDGs, especially for gender and peace security, but there's room for increased efforts and investment in greater participation for civil society so we can bridge these data gaps. So we can see participation actually of civil society and engagement contribute to transparency and then reporting systems. So here, I want to draw attention on adolescents and youth because at the start of the SDGs, we had that huge bulge of adolescents. They have found greater focus in programming. However, girls still get left behind. The region is experiencing a demographic shift with countries seeing an aging population, but some of the adolescent girls still face the same problems and challenges, including adolescent pregnancy. In South Asia, this has declined, but in Southeast Asia, this has increased. And this continues to pose health risks to adolescent mothers. So limiting their access to education and economic opportunities. So that remains true. And that you see now how these SDGs, when you look at it from a gender lens, actually have very much tied to young people's sexual health. So adolescent birth rates have been declining, but the progress is uneven. So if you see our SDG scorecard, it's just stagnating. So South and Southeast Asia experience a steep decline in adolescent birth rates as well, but not for the Pacific. Many births among girls under 18 take place within a marriage or union, so which is surprising. We do not speak much of child marriage, but it exists in our region, and it is causing these inequalities. So married adolescents tend to have less education, less household and economic power, less mobility. They tend to be isolated and lack knowledge and skills to negotiate situations that are detrimental to their health and well-being. So deciding where to give birth, when to give birth, is there money to spare to give birth is very it disempowers the girl who's married and is facing adolescent pregnancy. The gaps between spouses tend to be larger among girls who marry at younger ages. So we don't see them same age, 18. is usually like 5 years older or even like greater. Early sexual activity with an older partner has been linked to poor gender relations and poor reproductive health outcomes. Girls become mothers, brides, and brides. So they also undergo harmful practices, sadly, such as female genital mutilation, many yet without their consent. And a lot of young people still have no access to comprehensive sexuality education. While majority of the laws do regulate this and provide for this, but its actual implementation is a huge gap. So there is commitment to countries to improve this, but like efforts within countries are varied. So in many think young people, it's too early to have sexuality education, but the evidence points out, yes, there is unintended pregnancy, yes, there is child marriage, and even young girls menstruate earlier. So we need to address these underlying conditions, which is gender inequality. Girls need to decide and have alternatives to an early marriage and pregnancy. But again, this is a loop. It's specifically hard if you are also faced with challenges to education and employment. We need to build on girls, invest in girls, build their evolving capacity to nurture and the meaningful and inclusive participation of young people, especially adolescent girls. This requires specific funding, accompaniment structures, and capacity strengthening and dialogue to remove structural barriers and ensure the meaningfulness and inclusiveness of participation. Also, in the era of digitalization, there's a unique opportunity to utilize these solutions, technological solutions, to provide information and even extend health services. This comprehensive sexuality educations need on especially include sexuality, sexual health, need to adopt inclusive and pleasure-based approaches. To top this off, I want to also touch on another mega trend, which is climate change, because gender inequality has been exacerbated with the effects of climate change. Long-term, qualities diminish the gains we have worked so hard to achieve. Sexual and gender-based violence was termed before as the shadow pandemic, and it still persists. And the sad news is that we are not collecting data, and then this prevents us from actually having to engage more girls, engage communities, even engage boys and young men to have that inclusive approaches so that we can reduce the gap, the gender inequality gap there. Forging the path forward, we see that the development of countries and economies change as population dynamics change. And we see the mega trends of demographic shifts, aging, digitalization, and climate change have given rise to broader issues and the diversification of SR needs across the life cycle. So we want to bring this discussion to talk more about the intersections of gender, sexual health, climate change, and development, how these are affecting young people. We also want to look at, so after me, you will have to hear from other young leaders to talk about like other socially excluded groups, refugees, children at risk of statelessness, undocumented migrants, LGBTQ, indigenous people, sex workers, people who use drugs, people in prisons. So I hope you are able to sit through the rest of the presenters and then we can work together in getting that voice out to promote sexual health, equity, and rights for young people in all the diversities. So while girls are known to be like vulnerable, but they're all different kinds of identities that we want to bring on the table. So thank you for listening to me, and we hope to receive your questions and your comments in the chat, or feel free to open up in the discussion later. So over to you, Shobha.
Thank you very much. Thank you, lady, for giving such a clear picture of the problems faced by young girls and boys as well. And as you rightly said, access to education, including comprehensive sexuality education and access to employment, are essential to achieve sexual and reproductive health and rights. And thanks for mentioning climate change as well. Our next speaker is Pooja Mishra, National Youth Coordinator, Youth Lead Voices, and General Secretary of National Coalition of People Living with HIV in India, that is NCPI+. Pooja is a strong advocate to end violence, ensure everyone has access to healthcare services and social security. She was also a force for change at the world's largest AIDS conference last year, AIDS 2024, in Munich, Germany. Over to you, Pooja.
Oh, thank you so much, ma'am. And good afternoon, everyone. This is Pooja Mishra. I'm a National Youth Coordinator from Youth Lead Voices. YLB is the National Youth Forum under the aegis of National Coalition People Living with HIV in India, NCPI+. This is the youth empowerment initiative, the voice of the future through youth positive speaker. Thanks to CNS for this opportunity and platform to share about the SRHR in young people HIV and community. And India is one of the largest democracy in the world with a population of more than 1.39 billion, behalf of the whom are young people under the age of 25. The modern contraceptive prevalence rate of all women age 15 to 49 is a 56.5%. The maternal mortality ratio 97 deaths per lakhs. Live birth of women age 15 to 49%, 29% have experienced physical and sexual violence in a general population. So India have a more awareness and services for SRHR services, but need to get the services right people. So I just want to share some key challenges of sexual and reproductive health for a young PLHIV, including key population. Many young PLHIV, included KP, not be aware of the available SRHR services and their rights, also especially in a rural area, and have a fair judgment from healthcare provider or peer prevent young PLHIV from seeking help. Second is the most challenges, mental health challenges. In a young PLHIV, have a depression, anxiety, and other mental health issue significantly impact a young person' ability to access and utilize SRHR services. And third is the most of the time financial barrier is also challenges to access limited healthcare services, like people not be able to afford travel in a rural area and come to in city for the take the services. And the most crucial thing, fear of the disclosure, especially in a young man and woman. Young people HIV have a fair disclosure their HIV status to healthcare provider, fearing judgment, discrimination, and breach of the confidentiality. This fear is a barrier to get the essential services like a condom, PrEP, contraception, pregnancy counseling, and mental health support due to disclosure and lack of the youth friendly space. The absence of youth friendly space and services that are confidential, non-judgmental, and culturally sensitive can deter young people HIV from seeking help. Limited availability of services, insufficient availability of youth-friendly SRHR service, especially rural and remote area. But we need to be more pronged approach. This is the issue. Definitely, we are talking about the issue, but we need to take the pronged approach. So, peer approach can be highly effective in reducing stigma and promote SRHR among PLHIV in India, like a peer-led workshop, seminar, conduct interactive workshop and seminar on HIV and SRHR and stigma reduction. Especially in India, estimates suggested that each year at last 1.5 million girls under the 18 get married in India. Nearly 6% adolescents get age 15 to 90 are currently married. So definitely this is the convert also high risk in HIV. And second, community build within the existing organization. We need to collaborate with the youth organization and community-led organization to integrate the peer education into their existing program about the SRHR. We also approaching for a youth-friendly services. We approaching establishing and supporting youth-friendly healthcare clinics and that provide comprehensive SRHR services, including HIV prevention, contraception, and mental health support. It will be more powerful of community engagement involvement, young PLHIV in the design and delivery of the SRHR program and services. And last is the advocacy. Definitely, advocacy is the more effective for every program, for policy and program that address the specific SRHR need of young PLHIV in India. So that is the overview from young PLHIV in India. If you have any question that on this.
Thank, thank you very much, Pooja, and thank you for voicing the problems of young people living with HIV. And at this juncture, I think I would be honored to invite Manoj Pardesi from NCPI Plus. He's here with us. Uh, Manoj, will you please share something about your social enterprise where you leverage the power of youth to start this enterprise called TAL?
And
And
friends, this is the anniversary of
yes.
TAL Healthcare. This is a very important milestone which is providing connecting a number of people, thousands and thousands of people with sexual wellness services, with HIV services, with mental health services, lab testing, pharmacy, and it was started 100% by community leaders and people, including Manoj Pardeshi, who's amongst us. Pooja is also one of them, and we have it's a gold standard example of social enterprise. It was also presented at AIDS 2024. So over to you all.
Yes,
Thank you,
Manoj.
Bobby Bhai. Thank you, Shobha
Thank,
ji.
yes.
And thank you for giving this opportunity. It was surprising for me. So, okay. Basically, I will just continue what my friend from IPPF and Pooja has presented. Basically, what we see in our HIV, like work with people living with HIV and adolescent living with HIV, the major issue is the um correct knowledge of the sexual health, and also I will add mental health into it, because sexual health and mental health is um, like hand in hand. It should be hand in hand, and it should be the information and knowledge should be provided jointly. Second issue which both the speaker has highlighted is the access to all tools. If we see that huge knowledge is available about sexual health, but it's not reaching to the right people. All the prevention tools are available, but it's not reaching to the right people. So where is the gap? If services are available, if tools are available, and still if people are facing the issues around sexual health and mental health plus violences, it means the bridge between the demand and supply, that bridge needs to be strengthened. And since Bobby Bhai is highlighting TAL, TAL Plus is a treatment, adherence, advocacy, and literacy. It's a community peer-led community pharmacy and also integrated health center. Uh, so we ensure to increase um, access to quality services. We also ensure to mm, provide stigma-free services. That's the biggest thing. Services are there, but it's not accessible, and the biggest challenge is the stigma. So we need to provide stigma-free services. Lastly, the um, quality. So quality means like WHO approved medicines which can really work on the people, um, self-testings, PrEP, all these tools should be easily available and accessible to the people, those who are in need. Thank you so much, Bobby, for giving this platform. Thank you.
Thank you. Thank you, Manoj. And our next speaker is, we move to Pakistan from India, basically, and I invite Maria Iqbal Shah to share her insights on this critical issue. Maria is a passionate advocate for sexual and reproductive health, mental health, and gender equality. She's a core member of YPeer, that is Youth Peer Education Network, Asia Pacific, and mentor at Me for Myself International Mental Health Campaign. As a nursing student at Aga Khan University, Maria has led innovative projects on sexual and reproductive health and rights, mental health, and climate resilience. Her work extends to global platforms as a social media content creator for the UNICEF Regional Office of South Asia and as a member of the UN Women's 30 for 2030 network. Over to you, Maria.
Thank you so much, Shobha. So, hello everyone. This is Maria Iqbal Shah, and I'm currently a student in the BSCN program at Aga Khan University, Pakistan. And I'm also international core member of YPeer Asia Pacific, Youth Peer Education Network, Asian Pacific. Before I tell about the issues which youth is facing regarding SDG 3 and SDG 5, I just want to give short overview about YPeer Asia Pacific. So, as already mentioned in lady's slide, that CSC must be the solution for sexual and reproductive health. And as Pooja also emphasized on SRHR awareness. So basically, YPeer Asia Pacific solely work on the awareness part. We work on the comprehensive sexuality education and peer-to-peer education on sexual and reproductive health. So that's our main agenda as part of YPeer Asia Pacific. Okay, so I'm supposed to talk about the issues regarding gender and SRHR. So before I talk about the issues, I just want to emphasize on the WHO model, AAAQ model. So for any health service, this model is emphasized by WHO, World Health Organization. It's like A for acceptability, A for availability, A for accessibility, and Q is for quality. So in any service, there should be these four things. Like that particular service should be available, that particular service should be accessible, acceptable, and there should be high quality of that service. And if I talk about SRHR services, sorry to say, we are missing on several things. We are missing on the quality aspects, we are missing on the acceptance aspects. There is no acceptance regarding SRHR services in Pakistan because of the cultural and religious stigmas and taboos. Hardly we work on the SRHR related projects here in Pakistan. And then about accessibility and availability, again, due to the recent disasters and due to the climate change related issues, we are still struggling on the services or in the on the resources regarding SRHR, like contraceptive resources and menstrual resources. So yeah, that's the challenge. So before I move ahead, I discuss about the gender and about the SRHR. I just want to emphasize on one thing, that there are multiple genders and each gender is facing different issues. So for each gender, we need to first, understand those issues, and accordingly, we need to, cater those issues. So I'll be starting off with female issues, which mostly already mentioned by ladies' presentation. So female issues, which is like early child marriages, which are very much common, and due to which early pregnancies are there, which is causing higher maternal mortality and morbidities. Again, due to this early pregnancies, what's happening, it's affecting on the mental health of the women and females. It's causing preterm deliveries, it's affecting on the personal autonomy, and causing, early exposure to the abusive relationships for women and girls. Additionally, it's causing, because of the early child marriages, what's happening is it's again affecting on the quality education. Like students, female students are leaving their schools. They are not able to complete their education. There is disruption in the education, which is also leading to multiple challenges for women and girls. Other than that, we have gender-based violence, for which again women are affected, girls are affected, and also LGBTQI plus community is affected because of the gender-based violence, domestic violence, sexual harassment. And how they are affected? Because there is no acceptance of these genders. What's happening? No acceptance is leading to, their long-term mental health challenges, and they are having, without their permission, they are having sexual harassments, they are having domestic violence from their families, from their loved ones. So it's happening. Other than that, we have harmful practices, which already discussed by ladies. There is FGM, female genital mutilation, which is very much common in Pakistan, in regions of Punjab and Sindh, which is female genital mutilation, where what happens that in female reproductive part, there is removal of the clitoris. Clitoris is basically, the organ which provides sensation, pleasure during sexual intercourse. That particular organ is removed, which is leading to multiple challenges, which is causing pain, which is causing infection, which is leading to trauma to the female, women, and girls. Other than that, honor based violence is again very much common here in Pakistan. Femicide is common here, honor killing is common here. So you might know about it because if female does anything wrong, they usually have forced isolation. They usually have physical violence, or they kill the female. They kill the female because of the patriarchal system, because of the male dominancy here in Pakistan. There are other multiple challenges such as husband stitch, which is again very much common here in Pakistan. And yeah, moreover, I want to discuss from the intersectional aspect, which was already mentioned by ladies' presentation regarding climate change and SRHR. So most of you are already aware that Pakistan was recently affected by the floods, and these floods affected badly on women and girls. How it affected? We had this terminology here in Pakistan, which is called monsoon brides. Monsoon brides because family were considering women and girls burden, and due to which they were having their female child early marriages. Like they were selling their daughters. Like 10-year-old child is getting married, 13-year-old child is getting married, and these things were very much common because of the flood, because of the poverty which affected the family. Additionally, if I talk about the male challenges, so while I was searching for the issues regarding SRHR in male aspects, so I found this research regarding pornography. So I came to know that most of the males are affected by the pornography. I'm not generalizing this pornography with particular gender, but according to the literature, it was found that most of the male are addicted to pornography. And due to that addiction, what's happening? It's affecting on their mental health and also their sexual health. That's the challenge in males SRHR. Secondly, what's happening is there is lack of engagement of male in family planning. So we know about it. Like always, this family planning is considered as women issue. Always in Pakistan, or if I talk about the South Asian region, always we complain that female does this. Female should have control, but it's male issue, and there should be engagement of male also in these family planning services and contraceptive services. So that's another challenge which is regarding male gender. Apart from this, we have LGBTIQ plus community. Religious stigmas. There is, as I mentioned earlier, that there is no acceptance for that community, and they are also facing transitioning services. They can't have their personal autonomy. They are forced to marriages. And as per research, I found that in LGBTIQ plus community, there is this unique stress. Why this unique stress is there? Because of the structural stigma, victimization, and discrimination because of their sexual orientation and gender identity. And and LGBTIQ plus community is mostly affected mentally and sexually most of the time than transsexual community. Yeah. Apart from this, I found another research regarding chemsex, which was very much common in MSM, male sex with male. So there is this chemsex which should be, which should be given attention. Why? Because chemsex is a phenomenon that needs a multidisciplinary approach because it's affecting on the mental and sexual health of the homosexual people. So this was another challenge which I found through research, which is affecting particularly LGBTIQ community like gays. So yeah, these are some of the challenges which I discussed. Other than that, we found challenges regarding digital and technological divide, like cyberbullying and online harassments were there for all genders. There were no access to online SRHR resources. People, have misinformation. They search for, they want to know more about their sexuality, or they want to know more about comprehensive sexuality education. They search on internet and they found something else. So misinformation is another issue which is very much common. Data is missing here. We don't have policies, like we have criminalized, abortion for young people, which is again affecting on their sexual health, mental health. Mental health is badly affected. And yeah, comprehensive sexuality education is not here in Pakistan. Hardly we, because of the cultural and religious barriers, there is lack of knowledge, lack of awareness. Yeah. So these are some of the challenges which badly affect different genders here in Pakistan in SRHR aspects. Yeah.
Thank you. Maria, you want to continue or?
No, I'm done. I'm done.
Okay,
Sorry.
okay. Thank you, Maria. Thank you for a very, very informative and ground reality presentation. And it is just not the case in Pakistan, but wherever there are patriarchal setups, patriarchal societies, and wherever there is religious bigotry, these things are very common, as you said, in other South Asian countries. And basically, it is the harmful social norms, I think, and the onus of family planning being on the woman. Although the methods of family planning are, excuse me, controlled by men, most of them, but to control the family or plan the family, the onus goes to the women, and we see the difference in vasectomy procedures and hysterectomy, that hardly any vasectomy being done. And thanks for bringing up the point of chemsex as well. And pornography, you have brought up, yes, it does not only affect the mental health of the men, but it has very serious consequences for women as well, and young girls particularly. So thanks for a very enriching presentation, Maria. And now, last but not the least, is our next speaker, Gressa J. Pepito, a graduating psychology student from Philippines. And Gressa is an advocate for human rights and teenage pregnancy prevention. With 4 years of dedicated voluntary work with the Family Planning Organization of Philippines, which is called FPOP, she serves as the Vice President and Social Media Focal Person of Kabatang FPOP Masbect. Gressa is a certified peer educator committed to empowering the youth and fostering awareness about critical social issues. The mic is yours, Gressa.
Good day, everyone. Mabuhay.
Hi.
Greetings from the Philippines. It is an honor to be here with all of you today. So please allow me to introduce myself first. My name is Gressa G. Pepito. I am a certified human resource associate I have served as the Vice President of Kabataang FPOP Masbate since 2021, and I am also the social media focal person of our chapter. My passion lies in advocating for human rights and addressing the critical issue of teenage pregnancy. As a peer educator, I've actively contributed to advancing comprehensive sexuality education and sexual reproductive health and rights in our communities. My journey has been incredibly enriching. One of my most memorable experiences was being chosen as one of only two participants from the Philippines in Stories for Change, a digital storytelling for sexual reproductive health and rights workshop organized by IPPF itself in 2022. Additionally, I had the privilege last year of representing FPOP CSE Community Connect program during the National Conference on Family Planning YouthCon 2024. It is an honor to share my story and experiences with all of you today. So to start with, let me introduce who is FPOP. So the Family Planning Organization of the Philippines, or FPOP, is a non-stock, non-profit, service-oriented organization providing quality sexual and reproductive health services to all Filipinos, especially the poor and underserved. With 12 chapters across 13 regions, FPOP operates 17 permanent clinics and partners with 9 associated clinics to ensure SRH services reach even remote communities. Through these efforts, FPOP makes SRH care accessible to all. One of the most pressing issues we face today is the lack of CSE for Filipino youth. As highlighted in the Young Adult Fertility and Sexuality Survey of 2021, or YAPS 2021, first, let's talk about high-risk sexual activities. Many young Filipinos are engaging in behaviors such as early and unprotected sex, multiple sexual partners, and transactional sex, and even instances of coercive or violent encounters. These risky actions place them at greater danger for unintended pregnancies, sexually transmitted infections, and of course, emotional trauma. Without proper education and guidance, young people are left vulnerable to these realities. Second, the lack of accurate and reliable information about sex is a significant barrier. Many youth rely on social media and their peers for information, leading to widespread misinformation. It is also evident that topics about sex are rarely discussed openly at home, making it even harder for our young people, especially males, to receive accurate knowledge. This gap reinforces stigma and leaves them ill-equipped to make informed choices. Finally, access to SRHR services remain limited. Challenges such as the need for parental consent, financial barriers, transportation issues, and the availability of providers prevent young people from accessing vital services. This has contributed to the rise of in adolescent pregnancies and unplanned outcomes, leaving many youths without the support they desperately need. These findings from YAPS 2021 clearly show why CSE is no longer an option. It is a necessity. Through education, we can empower the young people to make informed decisions, advocate for their rights, and protect their well-being. The alarming trend of adolescent pregnancy underscores the urgent need for comprehensive measures to address the factors contributing to early pregnancies, including limited access to reproductive health education and services. In response to this concern, the Adolescent Pregnancy Prevention Bill, or the APP Bill, seeks to strengthen the rollout of comprehensive sexuality education, a key component of the Responsible Parenthood and Reproductive Health Law, and provide adolescent-friendly health services to address rising teenage pregnancies. However, the bill has faced significant challenges during its legislative journey. The passage of the APP bill is critical for safeguarding our future. This bill provides a comprehensive framework to address the root causes of adolescent pregnancy, including the lack of accessible sexual and reproductive health education and services and social protection, for young parents. By ensuring young people receive age and development appropriate, evidence-based, scientific, and culturally relevant information, the APP bill empowers them to make informed decisions about their bodies and lowering risks of abuse. It also paves the way for improved access to healthcare, particularly for vulnerable and marginalized groups, reducing the risk associated with early pregnancies, such as health complications and interrupted education, often leading to poverty. Passing this bill is not just about preventing pregnancies. It is about our rights, creating a brighter, healthier, and more equitable future for our youth. Advocating for the APP bill in the Philippines has encountered significant challenges, but despite the hurdles, advocacy groups have demonstrated resilience and adaptability. Organizations such as Reproductive Health Advocacy Network, where FPOP is a member, have intensified their efforts, urging the Senate to pass the APP bill without delay. The experiences from this advocacy highlight the necessity of continuous dialogue, community engagement, and education to build consensus and overcome misinformation and belief. Media plays a huge role in shaping perceptions and disseminating information, making it an essential ally in promoting sexual health, equity, and rights. By creating platforms that amplify the voices of young people, media organizations can foster open discussions about topics often considered taboo, such as reproductive health and gender equality. Moreover, partnerships between media and advocacy groups can strengthen educational campaigns that target both urban and rural audiences. By using accessible formats like infographics, short films, and interactive online sessions, the media can effectively deliver accurate and engaging content tailored to the needs of different communities. Collaborating with the young influencers and advocates ensures that the messaging is relatable, empowering the youth to take charge of their sexual and reproductive health while fostering a culture of equity and respect. Through such collaborations, the media can help create a society where young people are informed, supported, and empowered to exercise their rights responsibly. As we conclude, I want to remind all of us that our voices, no matter how small they may seem, hold the power to create meaningful change. To my fellow young people and advocates, let's continue to champion sexual health, equity, and rights, not just for ourselves, but for the generations that will follow. Together, we can build a future where every young person is empowered, informed, and respected. Thank you so much, and more power to all of us.
Thank you, Gressa. And yes, all power to all of us. And your voices are not small. Small is always beautiful, and small is very powerful too. And thanks for putting into spotlight unplanned pregnancies and also lack of access to safe abortion. And while Thailand celebrates legalization of same-sex marriages, this is on another note I'm talking of, we also have a country which is going strongly against sexual and reproductive health and rights. That is USA, with the passing of new laws, and they have withdrawn all facilities to diverse, which were available to diverse communities, including LGBTIQ. So the world is a strange place, but we have to make it a livable place for everyone. Thank you for your presentation. And unfortunately, our friend Let Logonolo, a South African legal practitioner and a member of Johannesburg Society of Advocates, could not make it today due to some severe health issues. They have sent their apology and have promised to join us in some future session. So we wish them a speedy recovery and move on to the Q&A session. Please type in your questions, comments, and remarks in the chat box, and we will take up the questions. Also, I find some questions have been answered by the respected speaker, but we would like the answer to be shared with everyone, because something which one person has asked would be the answer would be beneficial to all of us. I would first read a remark, a comment by Catherine Murumbedzi. She's a very senior journalist from Zimbabwe, a health science journalist from there. And she says, in my country, Zimbabwe, some facilities have a youth-friendly corner manned by young people. This makes access to sexual and reproductive health services easy. I hope more organizations will support more such enterprises. Very rightly said, Catherine. There is a question for Lady Lisondra, which she has answered, but lady, I would like you to answer again. The question is from Mahima, and the question is, can you please explain what can youth and others do to protect SRHR services, as climate change threat needs government efforts? But what can we do to protect SRH services from climate extreme events? Lady, would you like to just read out your answer? Are you there?
Yes. So
Yes.
yes. So
Please.
I mentioned, like, we have young people like Gressa on the ground advocating, and we're training a lot of youth leaders to advocate for CSE and also education on climate change. So without our children knowing what our consumption, our daily impacts, how it affects our environment, we will not make a sustainable change. So we want to highlight the interlinkages between sexual and reproductive health and climate change. So, like, maternal health and climate change, migration, climate change, even menstrual health and climate change. We want these discussions to take place to educate young people. We have an informed society. We can change our policies, and we can build a strong and resilient community. So I think the resilience and adaptation comes with the education and the engagement of the community. Thank you.
Thank you. And there's a question from Joyce also. What more can be done to fight adolescent marriages and teenage pregnancies? And this is open to others as well. But lady, would you give your response first? What more can be done to fight adolescent marriages and teenage pregnancies? Yes.
So we need data on this. We need programs, but we also need to change our laws. And I believe my colleagues from the regions who are very much affected with child marriages can also speak up. And I'll give the floor. Segue to colleagues from India and Pakistan.
Yes. Please, other speakers, would you like to respond to this question? Maria?
Yeah, sure. I would like to respond to this question. Also, I guess Jitima has asked similar question.
Yes. Jitima, I would, right. I will I will read out Jitima's question. She says, what are the laws regarding child marriages and LGBTQIA+? Are there legal barriers too? How can we advocate for change globally? Yes.
Yeah. So as already mentioned, that there are legal policies here in Pakistan, and I'm sure that there are policies in other countries too regarding the child marriages. But the thing is that people still won't follow that. There is no, penalty kind of thing in these policies. That's the first thing. There should be penalty or some sort of, fine regarding this. If someone is breaking this child marriage, if someone is breaking that particular law or having child marriage, then there should be penalty. That's the one thing. Second thing which I want to share is there should be monitoring and evaluation system, like proper monitoring that whether people are following the policies or not. So again, which already mentioned by Jitima, that there are policies, there are legal barriers, and how can we advocate? So as per me, government can advocate by having this monitoring and evaluation system. Yeah, so that's the thing. Now I want to answer the second question which Jitima asked regarding LGBTQIA plus laws. So unfortunately here in Pakistan, we don't have laws. We have laws regarding transgender community, but we don't have laws for other lesbian, gay, or other communities, other minorities, because because of the cultural and religious stigma, because Pakistan is Islamic Republic country of Pakistan. So because of the Islamic principle, it's considered, a stigma and taboo. And then Jitima is asking, how can we advocate for change globally? So number one step is sensitization and comprehensive sexuality education. That's the very basic thing, and that's the very important thing on the prevention level or the primary level. Like there should be awareness regarding comprehensive sexuality education. If there is awareness, there is sensitization regarding SRHR, then it would be easy for us to further advocate for such policies and for further change. Yeah,
Thank you.
that's my answer. Maybe
Yes.
someone else can share their
Yes,
perspective.
yes. There is a question. If Manoj is there, Manoj and Pooja, if you could answer this question. There's a question from Ashok Ramsarup. He's a very senior journalist and former senior producer at South Africa Broadcasting Corporation. Ashokji wants to know how are young people's rights to participate in decision-making processes related to their sexual and reproductive health protected and promoted in India and the rest of the world. Young people's rights to participate in decision-making processes. How are they related to their sexual and reproductive health? Would Pooja or Manoj like to respond? Pooja, would you like to respond? And also, Pooja, there is a question that if there is any youth-friendly way in which HIV and others SRH services accessible to young people. In some countries, younger people need to be accompanied by their guardian for an HIV test.
Sorry, some technical issue. That's why we are
Okay.
late. In India, we don't have any youth-friendly services like health and any other services. So we are approaching for this, but still don't have any youth-friendly services. And if we are talking about the Child Marriage Act, but we need to more sensitization and awareness for this, especially in rural area.
Not in cities. I feel
Yes,
it is prevalent in
cities.
cities also, but maybe on the slide. Maybe people don't come to know of it. Yes, maybe. Yes,
Yes,
you're right.
mainly in a rural area, especially
Yes.
because in a rural area have a more child marriage,
Yes,
according to UNICEF data. So that's why we need to more sensitization and awareness on this thing.
Okay. Yes, and this question also that are the adolescents or young people, then do they need to be accompanied by their guardian for an HIV test in India? Is it a
Yes.
rule? Is
Uh,
it legal?
uh,
They cannot be tested otherwise.
no, age of 18. Uh,
Okay.
age of 18, we need to guardian for a testing.
Okay.
Yeah.
And then Joyce is asking a question again, it's open to everyone. Is lack of strict laws against perpetrators one of the factors leading to increased rate of young marriages? That there is the one who's marrying the young girl, that person is not penalized. Shouldn't that person also be penalized? Pooja
Yes,
and others.
yes,
But
but we know it's a legal, not a legal age, but
it is not.
definitely it's.
It should be, because that person is also part of is committing a crime.
Yeah, it's a crime, but how can brief?
Right.
It's a
Right.
definitely a crime because it's a not our government act to
Yes.
marriage
Like
within the age.
Hmm.
So definitely this is the crime, but socially not very open.
Right.
When marriage income within the 18, it's a not open out.
Yes.
The very hiding things.
Yes.
That's why not open and that.
Exactly. What about our other speakers? Others have also mentioned about child marriage. So, can you respond to Joyce's question? That should there be strict laws against perpetrator also? Perpetrator means the one who's marrying the young bride. Yes.
I guess
Yes,
yes.
Nidhi.
So
Yes.
because there in Indonesia, what we could share is that they
Mm.
did change the laws on
Mhm.
child marriage, but what happened was also they had these backdoors, dispensations of marriage. So you can go the legal system would say it's banned, but you can go to your religious court and get an exemption. So that's how like a lot of young girls fall through the cracks. So I believe that we need to have this dialogue, like put in a comment, like changing the behaviors and attitudes within the community is
Yes.
very more important rather than penalizing. So they just we just see more violence, more girls being isolated with these kinds of happenings. So I guess it's a long way to go, and I think the media has a very good role in terms of influencing that shift, that change in like social norms and practices.
Yes,
Thank
yes,
you.
yes. Thank you. Anybody else would like to add to that? Any other speaker? All right, we have also running short of time. So, okay, there is, let me check. Yes, 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 Joyce, please ask. Joyce has raised her hand. Yes, Joyce, go ahead. Ask. You can ask your question if you are unmuted. Bobby, can you unmute Joyce, please? Bobby, can you unmute Joyce? Yes, yes, Joyce.
Yes. Thank you everyone for the session. Yes, still about the strict laws about towards the perpetrators. You know, here in Uganda, what they do, they punish the parents of the child who has been taken into early marriages. So I'm wondering why the punishment goes to the parent and then the perpetrator himself is not punished. Because if they punish the parent, that means they're doing something wrong. So the perpetrator would have been punished the same way the parents are punished, because they are sending the child to that perpetrator, and that perpetrator is receiving the child. So I'm wondering, how is the law in other countries apart from
and anybody would like to answer that? The law in, we've heard the law in Indonesia. What about Philippines or Pakistan? Yes.
Yeah, in the Philippines, we also just recently passed that law. It did receive a lot of backlash with our indigenous groups because there hasn't been a lot of sensitization and like consultation. So that has been the work of our Council for the Welfare of Children to bring these discussions without penalization, because then it creates a lot of conflict and it creates a very not secure environment for the girls in the community. So they're working to have these conversations and then organizing their youth councils as well to have that discussions within the indigenous communities. But we also have it. We have to learn as well from the countries too. We are very new at this policy as well.
Okay, thank you. Maria, would you like to add something?
Yes, Shobha. Could you please repeat the question? I'm so sorry, my internet connection disrupted.
Okay, this is about, even I have lost the question now.
I guess
It's about child marriage and like what is the law about regarding child marriages, and if a child marriage occurs, what does the law say on that?
okay. So we have penalizing law against child marriage here in
Can't hear you.
Hello.
Hello, yes.
Am I audible?
No, yes, now you are audible. Yes.
Yeah. So I was saying that there is a Child Marriage Restraint Act here in Pakistan, and there are multiple laws against child marriage, and there is punishment for parent and guardian. If there is, child marriage occurring, then there is proper punishment for the guardian concerned or the parent who is involved in this particular process. So I'm sharing that particular law here in the chat box also. Maybe you can further read from there. And again, there is fine charged here in Pakistan, rupees around 5 lakh, if child is around 3 to 7 years old and they are having forced marriages for underage children. So family has to pay around 5 lakh rupees. So there is another law regarding it. So both of them, I'm sharing both links in the chat box. Yeah.
Okay. Thank you. And Catherine says that in Zimbabwe, it is a punishable crime. But sadly, some families cover up. And then George says in Zambia, it is a serious offense, which is good. Then Agnes says in Zambia, if you marry a child below 16 years, it will be a case of defilement. All right. Any more comments? So I think we come to the close of the session. And my sincere thanks once again to all the speakers for energizing our minds with their very pertinent and invaluable inputs. Special thanks to the participants for their lively interaction, for their comments and questions. And the conversation continues, the dialogue continues, and let us continue doing our little bit through our writings and advocacy to help the torch of gender justice burn brighter with each passing day. Namaste and goodbye till we meet again, and we'll meet again soon.